If you are turning 65, or perhaps you're already on Medicare, let me ask you a question. What does your mailbox look like? Is it overflowing with glossy, full-color mailers featuring smiling, silver-haired couples on sailboats and golf courses? Is your phone ringing with calls from friendly-sounding people who want to talk to you about your Medicare options? It can feel like a full-scale assault, an avalanche of information, an alphabet soup of parts A, B, C, and D, and a lingering, nagging feeling in the back of your mind that asks, who can I actually trust? It's a feeling of being overwhelmed, and frankly, it's exhausting. But what if I told you that the federal government, your government, funds a free, professional, one-on-one counseling service in every single state, territory, and the District of Columbia, specifically designed to help you navigate this maze? A service with over 12,000 trained counselors, whose only job is to provide you with completely free and unbiased help. And what if I told you that despite this program existing for over 30 years and helping millions of Americans, the vast majority of people turning 65 have never even heard of it? That's what we're going to talk about today. We are going to pull back the curtain on what I believe is the single most valuable, underutilized, and important free resource available to anyone dealing with Medicare. The title of this video calls it a secret. And while it's certainly not a secret from the government, for millions of Americans who are confused and anxious, it might as well be, because they've never been told it exists. We're going to change that today. In the next few minutes, I'm going to explain exactly what this resource is, how it's fundamentally different from almost every other source of Medicare advice you'll encounter. And most importantly, I will walk you through step by step how you can access it for yourself, right from your own home, completely free of charge. My goal is for you to leave this video feeling empowered, clear, and confident, knowing you have a trustworthy advocate in your corner. And a quick but important reminder, I am not an insurance agent or a financial advisor. This video is for educational and informational purposes only. The goal here is to connect you with expert, non-commercial resources so you can make the best decision for your own unique situation. The program we're discussing today is one of those premier resources, staffed by certified counselors who can provide that personalized advice. So let's start by acknowledging the reality of the situation. The moment you approach Medicare eligibility, you become a target. That sounds harsh, but it's true. You are a valuable potential customer for a multi-billion-dollar industry. Insurance companies spend enormous sums of money to get their plans in front of you. They hire marketing firms, they buy mailing lists, they run television commercials with beloved celebrities from our youth. And then there are the insurance brokers and agents. Many are good, honest people trying to make a living, but it's critical to understand their business model. The vast majority of brokers work on commission. When they help you sign up for a specific Medicare Advantage plan or a Part D prescription drug plan, the insurance company that provides that plan pays them a fee. This is a simple fact of the business. The problem is, this can create a potential conflict of interest. Is an agent recommending a plan because it is truly, objectively, the best one for your specific health needs and budget, or because it pays a higher commission? It's often impossible for you to know for sure. This is the very dynamic that creates that sense of distrust and confusion that so many people feel. You're trying to make one of the most important healthcare decisions of your life, and you're doing it in an environment that can feel more like a used car lot than a trusted advisory service. This is precisely the problem that the United States Congress recognized decades ago. They understood that seniors and people with disabilities needed a place to get straight answers without a sales pitch attached. And so, back in 1990, they created and funded a program to do just that. This program is called SHIP, which stands for the State Health Insurance Assistance Program. So what is SHIP? Let's be very clear. SHIP is a national program, federally funded by the Administration for Community Living, which is a part of the U.S. Department of Health and Human Services. It provides free, in-depth, one-on-one insurance counseling and assistance to Medicare beneficiaries, their families, and their caregivers. Every state has a SHIP program. Some states give it a different name, like HICAP in California, which stands for Health Insurance Counseling and Advocacy Program, or SHINE in Florida, which stands for Serving Health Insurance Needs of Elders. But no matter the local name, they all operate under the same federal grant and the same core principles. The most important of these principles is that they are completely 100% unbiased. SHIP counselors are highly trained specialists. They have to pass certification tests and receive ongoing education to keep up with the constant changes in Medicare. But here's the most important part. They are strictly prohibited from selling or endorsing any insurance company or policy. Let me say that again, because it is the absolute heart of why this program is so uniquely valuable. SHIP counselors cannot and will not sell you anything. They don't receive commissions. They have no financial stake whatsoever in the choices you make. Their only mission, their only key performance indicator, if you will, is your understanding and your empowerment. Think about the kinds of questions that keep people up at night. Things like, what's the real difference between original Medicare with a Medigap plan versus a Medicare Advantage plan? How do I even begin to compare the dozens of Part D prescription drug plans available in my county? I think I might qualify for programs that help with costs, like the Medicare Savings Program or Extra Help. But how do I apply? My doctor just told me I need a new expensive medication. How do I find a plan that will cover it without bankrupting me? I was denied coverage for a service I thought was covered. What are my rights, and how do I file an appeal? These are the exact kinds of complex, personal, and often stressful questions that SHIP counselors are trained to help you with, one-on-one. They can sit with you either in person, over the phone, or in a virtual meeting, and use Medicare's official plan finder tools to compare the specific plans available to you, based on your specific list of medications and your preferred doctors and hospitals. They can explain the fine print, define the jargon, and demystify the entire process. They are, in essence, your personal Medicare translator and guide. In 2020 alone, these counselors provided personalized help to more than 1.8 million Medicare beneficiaries. That's 1.8 million people who got their questions answered without having to wonder if there was a sales pitch hidden on the other side of the table. This brings us to the fundamental difference, the unbiased advantage. Imagine you have two people advising you on buying a car. The first person is a car salesman at a Ford dealership. He's not going to tell you that the Honda down the street might be a better fit. The second person is a trusted mechanic who has worked on your family's cars for 20 years. His only job is to look under the hood, tell you the unvarnished truth. The car salesman is like a commission-based insurance broker. The trusted mechanic is like a SHIP counselor. When you speak with a SHIP counselor, you are getting the trusted mechanic. Their loyalty is to you and only you. This completely changes the dynamic of the conversation. You can let your guard down. You can ask what you might think are silly questions, although no question about your health and financial security is ever silly. You can be completely honest about your budget, your health concerns, and your anxieties. The person on the other end of the line has no agenda other than to help you. They aren't trying to steer you towards a particular plan C or provider Z. They are there to lay all the cards on the table, face up, and help you read them. This is an incredibly rare and valuable service in today's healthcare landscape. It is the difference between being sold to and being served. And this service, this trusted, expert, unbiased guidance is available to you right now for free. All right, let's just take a quick pause here. If you're finding this information helpful, I would be so grateful if you could take just a moment to tap that like button below this video. Now let's get to the most important part. Knowledge is wonderful, but it's only powerful when you can act on it. So, how do you actually find and connect with your local SHIP program? It is remarkably simple, and I'm going to walk you through it right now. The official national hub for the entire program is a website. The address is shiphelp.org. That's shiphelp.org. You'll notice that it's a .org address, not a .com. This is your first clue that it's a non-commercial, mission-driven organization. Right near the top of the page, you will see a big button or a link that says something like Find Local Medicare Help or SHIP Locator. When you click on that, it'll take you to a map of the United States. All you have to do is click on your state. Let's say you live in Pennsylvania. It will show you a statewide toll-free phone number you can call. It will often list a direct website for the state program and an email address. This is your gateway. Your next step is to simply pick up the phone and call that number. When you call, you'll be connected with someone who can schedule an appointment for you with a certified counselor in your area. These appointments can be over the phone. They can be virtual video calls, and in many areas, they are even available in person at local senior centers, libraries, or area agency on aging offices. It's that direct. There are no hoops to jump through, no long forms to fill out, just to get a call back. Now, a quick pro tip to make your counseling session as productive as possible. Do a little bit of homework before your appointment. Try to have a list of any prescription drugs you take, including the exact names and dosages. Also, make a list of your important doctors, specialists, and preferred hospitals. Having this information handy will allow the counselor to input it directly into the Medicare Plan Finder tool and give you a real-world comparison of how different plans would cover your specific needs. Think of it like going to the tax accountant. You can show up with a shoebox full of receipts and they can help you. But if you come with your documents organized, you'll get a much clearer picture, much faster. The impact of these counseling sessions can be life-changing. I want to share a couple of stories. Let's imagine a gentleman we'll call Robert. Robert is 64, a retired plumber. His fishing buddy has the same plan and loves it. Robert was just about to sign up, but his wife convinced him to make a call to their state's SHIP program first. During the free counseling session, the counselor asked Robert for his list of medications. The plan his buddy had would leave him with thousands of dollars in out-of-pocket costs for his prescriptions each year. She then showed him 2 other plans. The counselor didn't tell him which one to choose. She just explained the total costs and benefits of each option. Robert went from being confused and almost making a costly mistake to feeling clear and in control. He chose a plan that saved his family over $4,000 a year. That is the power of unbiased information. Or consider a woman we'll call Mary, a retired schoolteacher. Mary was so overwhelmed by the alphabet soup of Medicare that she was paralyzed with fear. She didn't know where to start, and she was terrified of making a mistake. A friend told her about SHIP. She made a phone call with a trembling hand, expecting a complicated and confusing conversation. Instead, she was greeted by a calm, patient counselor who started by simply saying, "I know this is a lot. Let's just take it one step at a time." Over the course of an hour, the counselor patiently walked Mary through the basics of Part A and Part B. She explained the two main paths: original Medicare with supplements or Medicare Advantage, using simple analogies. By the end of the call, Mary didn't have all the answers, but for the first time, she had a clear understanding of the questions she needed to ask. She had a checklist. She had a partner. She went from being frozen with anxiety to feeling like she could finally breathe. This transformation from confusion and anxiety to clarity and confidence is what SHIP delivers every single day. This all sounds wonderful, right? It's free, it's expert, it's unbiased, it's been around for over 30 years, which begs the big question. If this is so great, why has almost nobody heard of it? Why is it the #1 Medicare resource that nobody talks about? This is a fantastic and important question, and addressing it is a core part of our mission today. The answer is actually quite simple and comes down to two things: marketing budgets and mission. First, let's talk about marketing. The major insurance carriers have marketing and advertising budgets that run into the hundreds of millions. They can afford to blanket the airwaves with commercials, fill every mailbox in the country, and run sophisticated online ad campaigns. The SHIP program, on the other hand, is a government-funded service. Their voice is a whisper in a room where the insurance companies are shouting through megaphones. They simply cannot compete with the sheer volume of commercial advertising. Second, and related to this, is the issue of mission. The mission of an insurance company is to sell insurance policies and generate revenue. The mission of SHIP is to provide education and counseling. They aren't trying to acquire you as a customer. What's even more concerning is that this invaluable program's federal funding has been threatened in past budget negotiations. It's a program that relies on continued government support. This highlights just how important it is for us as citizens to not only use this service, but to be aware of its value. Its relative obscurity is a known issue, a problem of public awareness, not a conspiracy, and that's why making this information more widely known is so critically important. You now know about it. You are now in the know. And you now have the power to not only help yourself, but to help your friends, your family, and your neighbors by sharing this information. So let's bring this all together. The journey into Medicare does not have to be a solo flight through a storm of confusion and sales pitches. You don't have to rely on a neighbor's advice or a broker's potentially biased recommendation. You have an advocate. You have a free, professional, unbiased resource waiting to help you. That resource is your State Health Insurance Assistance Program, or SHIP. You now know that SHIP counselors are highly trained experts whose only job is to empower you. You know they don't sell anything, and their advice is 100% focused on your best interests. And you now know the simple, actionable steps to find them at shiphelp.org and get the personalized guidance you deserve. The ultimate win here is not just about potentially saving money, though that is a very common and wonderful outcome. The real victory is the feeling of taking back control. It's the shift from feeling like a passive target in a complicated system to becoming an active, informed, and confident director of your own healthcare journey. That is the peace of mind you deserve, and it is available to you. Now, I would love to hear from you. Before watching this video, had you ever heard of the SHIP program? And for those who have used it, what was your experience like? Please share your thoughts and stories in the comments below. Your experience could be the very thing that encourages someone else to make that important call. And finally, if you enjoyed this deep dive and want more content designed to empower you and help you navigate your health and finances in retirement, please be sure to hit that subscribe button and ring that little notification bell so you don't miss our future videos. Thank you so much for spending this time with me today. Be well, stay empowered, and I'll see you in the next video.